Hello, my name is Maggie Buckley, and I'm a board certified patient advocate. I have no conflicts of interest to declare. I've been tasked with wrapping up all of the information we've learned today into the context of how to make it happen. I must acknowledge that every individual presents differently, and there's no single pathway to follow. That being said, in an ideal scenario, any patient who presents with new or worsening symptoms would be seen by a full healthcare team that would be able to confer in real time with the patient to figure out differential diagnoses, testing, and treatment plans. In the real world, the patient experience involves multiple encounters with varying amounts of time between consults, testing, and trying out different treatment options on the way to finding something to ease pain and discomfort. Time constraints and delays should be balanced in this population when nutritional health is in play, as the implications may accumulate, thereby increasing risks to health and life the longer it goes without attention. As we've learned in the presentations today, early intervention with nutritional guidance and appropriate support may be an effective clinical tool with this population. So what is the most efficient way to get care needed? As with other aspects of healthcare, the principles getting from symptoms to treatment and management are communication, persistence, and follow-up. Patients should be forthcoming with communication, and providers should be communicating with one another to coordinate care. Patients should be persistent in asking for what they need, and providers should be persistent in submitting referrals for approval and communicating with other providers. Patients should follow up all treatment steps by communicating any change or lack of change in symptoms. In addition to asking the patient follow-up questions about symptoms, providers should follow up with one another to support one another's efforts. In the spirit of patient-centered care, let's start with the patient experience. As soon as you notice any symptoms, you, the patient, should start tracking them in a journal, in an app, on a calendar, or in whatever makes sense to you. Be as detailed as possible. Find a way to gather data and stick with it. Be conscientious about tracking these symptoms, plus anything else that is going on with you and around you as you experience each symptom. For example, your mood, the weather, what you're doing, what you stop doing, any events around you should all be noted. Be sure to include notes on anything that alleviates symptoms that you have tried and have had no impact. Include information on the frequency of your bowel movements and consistency. When you present your case, refer to that detailed information as you draft a message to your doctor, bearing in mind that your goal is to communicate something is amiss in as concise a manner as possible. Start with your primary care doctor. And keep in mind that most people go in and they tell this long story about their whole journey and everything they've experienced for years and years and years, and every little detail. And 20 minutes later, or at the end of the appointment, they say, so I think I need to see a nutritionist or a GI specialist or whatever it might be. So flip that usual script and start with the conclusion that you need that referral to the GI specialist or nutritional professional because you're experiencing new GI symptoms. So that's your first statement. Open with the ask. Make sure that you express that as, I need this referral because I'm experiencing new or worsening symptoms such as pain, nausea, weight gain, bowel movements, changes, weight loss, whatever it may be, because it's affecting your life negatively. It's important to say whether and how the changes are affecting your daily living. For example, let them know if you cannot leave home. Let them know you're unable to work or unable to sleep, unable to care for yourself, any negative moods, any depression, that you feel you need to be close to a toilet, etc. Whatever those symptoms are and whatever impact it has on your life, that's the important information that needs to be included as you communicate your message. If you're concerned about your nutritional intake, say so. If you're most concerned about weight loss or weight gain, then start with that. Again, keep track of the frequency and consistency of your bowel movements. Everybody's going to be asking you about them. So get over the inhibition of wanting to talk about it and actually write it down. Let them know that you've been keeping a symptom journal to track anything that could offer clues to a pattern, mitigating factors, trends, and pain. And you have to trust the doctor that once you've told them you have all of this detailed information available, you have to trust that that doctor is going to be asking questions to tease out the key points that they need to translate into the medical record or into the communication with other healthcare providers. Trust is very important here. From the practitioner side of the equation, when faced with the complexities of a patient with connective tissue disorder experiencing new or changing GI issues, ask them about the impacts on daily living, in addition to the usual workup of medical history, symptoms, recent changes in lifestyle, habits, diet, etc. Ask them how it's impacting how they interact with their family. Do they go to work? Do they go to school? What else is going on? Compare the situation with this patient, with this outpatient that you're seeing. Compare that to how you would approach an inpatient case with similar symptoms. Would you call in a dietetics evaluation for an inpatient with this presentation or with these issues? Then the wording for your outpatient referral would be just like that referral that you did for the inpatient. Be persistent with the system to push that referral through with thorough notes that it is needed based upon presentation, daily living impacts, and any risk of not getting the referral. For the patient to have access to any type of specialist care, there are some common elements to consider. Diagnostic codes and treatment codes should align with billing codes. These codes vary by geographic location and healthcare symptom, so they may not always be the same. If you have questions about these codes, contact the records and billing department within your hospital or healthcare system to verify the codes that are appropriate for the current case. Include all kinds of notes and supplemental documentation, documenting how the lack of nutrition counseling is affecting daily life is key information to justify healthcare expense. Documenting the risks to the patient of not getting the referral is just as important to note when a pre-authorization is not needed. Impact should appear in clinic notes, correspondence, and billing memos to support the case for coverage. Collaboration brings these principles together. Patients and providers should expect to share information freely and be open to ideas from one another of things to try. Sometimes a referral may be denied, making it necessary to appeal the denial. Collaboration, where all information is openly shared, makes it easier for all parties to consistently argue the case for approval or coverage. Sometimes it's the patient who has to argue the case for coverage. Sometimes there's additional information required from the referring physician or the nutrition specialist. But if everybody's sharing their notes, they're all using the same terms and citing the same impacts to daily living and function, then it's more likely that the appeal will be approved successfully. Any member of the healthcare team may offer to request letters of support from different providers to support coverage of the treatment. Patients should be aware that some providers may impose a charge to send a letter, and sometimes it's necessary. Communication should not end once a referral is successfully submitted and the first consultation appointment with a nutrition professional is set. The patient should still be journaling to track symptoms and note changes. Providers should still follow up to check in with the patient to watch for any changes, good or bad. This includes the referring healthcare provider and the nutritional professional. What we're looking for is to make sure that the original issue that motivated the patient to reach out is being addressed. And we want to find out if any new issues may have arisen during treatment, possibly because of treatment or because of other new problems that are happening around all of this. More testing may be needed to check for deficiencies. So the GP could proactively ask the nutrition professional if they have recommendations for testing, if there's deficiencies that they might want to monitor over a long period of time. Most people have well check appointments or checkups annually or every other year. That includes a blood panel to check, cholesterol and all that regular stuff. So that's an opportunity for the GP to get the information from the nutritional professional and say, oh, I'm going to add this additional testing into that regular panel because we want to monitor those deficiencies that you've experienced in the past to make sure they haven't become a new problem or exacerbated issues that are going on here. And a GI specialist may also consider doing the same thing if they're testing more frequently. Clearly documented communication between the GP, the GI specialist, and the nutritional specialist, plus the patient, should be facilitated by all parties. If you haven't heard from somebody in a while, reach out to them and ask, because in this population, nutrition issues and the impact on the GI system are not usually resolved very quickly, as we've learned today. There's a lot of long-term care and management that needs to happen. So let's make sure we don't lose that connection and we're still communicating with one another. So in conclusion, we're back to the 3 principles of care that we started with: communication, persistence, and follow-up. Collaboration happens if these 3 principles are in use, and helps to activate the 3 principles as tools to access nutrition support in this complex population with these very complex healthcare situations. Thank you for your attention.